This government meeting is brought to you by Eastworks and our local cable subscribers.
Okay, good afternoon, everyone. We are ready to begin. We have a quorum. This is the June 18, 2024 meeting of the Council on Aging. We'll begin with roll call. Tom Brown is here. Pat Ruff.
Has an excused absence.
Okay. Catherine Carey.
Here.
Stan is here. Marie.
Here.
Louise. Yep. Kathy.
Here.
And Crystal.
Here.
Thank you. Do you have a quorum? Acceptance of minutes from the May meeting. You should have all received a copy of the minutes. Are there any additional corrections?
I made the correction that Cindy sent to add with participants under number 4, Highland Valley Report.
Okay.
I made that.
Sorry, I think I have one. This is the agenda, not the minutes. I have because I do have something about the minutes.
So you're all set, Louise?
Not yet. So not connected. I do have a question about are we making corrections to the whole group? Sorry, by email? Because
No, you could bring it up here. If there's something in the minutes that is incorrect that we need to fix, but we can't actually change what was factually said.
oh, I know.
But if there's something that's like Louise said this and you said, no, that's not what I said something different, we could make that change.
It's pretty close to that, but I didn't have time to. I'm asking.
We would make it here.
So people saying you missed this.
Yeah, any corrections to the minutes you could bring up right now, and then we can make it.
That's not my question. When I was secretary, I was told that even simple things could not be changes. Could not be.
I think they can be changed if they're incorrect,
No,
but they can't be changed.
point.
You meant ahead of time.
I
Like
meant, no, I meant open meeting rules, whatever. You can't communicate with everyone to say something's right or something's wrong.
I think you can communicate as long as it's not deliberative or as part of a vote that's expected to be taken. It's okay for us to communicate as a group as long as it's not deliberative or part of connected to a vote.
Well, that would have made it easy when I was trying to change the spelling of my last name.
Yeah, that would be fine. Although it's okay to communicate that directly to the secretary also, if it's something that simple. If it's a misspelling of a name, you could communicate that directly. You don't have to communicate it to all.
That's what I thought.
Yeah.
Okay.
Yeah.
Did I misspell your name?
No,
That was previous, I
that
think.
was
Director had it in his mind, and therefore a lot of people kept misspelling it for a long time,
Yeah.
including when I joined the board as minutes.
Okay, with that, are there any other changes or corrections or additions to the
I have to
minutes?
find. I'm sorry. Does anybody have them printed out?
There's a copy printed out for you.
This is the agenda.
The minutes.
Yeah, they're right there.
Oh, I see. These they don't say minutes. Okay. Yes. And I'm not sure how to put it, but under internet access for older adults.
Yep.
Somehow most of what I said was missed. And because I did, okay, so I've been right to this. My concern is internet-related wants and needs. My concern is really more of a question of, I guess, a culture change. And I was trying to say this last week, but the way I've been treated, the way a lot of other people have been treated who tried to approach the COA by internet, because that's obvious to them. Even when I mentioned to you, when Spectrum, God help them, messed up my internet. I did not have internet for 2 months. To me, that was an absolute utility. It was very, very difficult. And I think the attitude of the COA, this is getting more personal, but obviously that didn't get through. We've got, like, I know you don't have an online portal yet. I know, yes, I agree with concerns about exposing to scams, but I mean, people on the phone are exposed to. What I'm trying to say is, the treatment of people who don't yet have internet, that's important. The treatment of people who do and don't rely on phones. I mean, even your social workers, you were saying once that they spent a lot of time on that Christmas with that message to seniors. It was 100% useless to me, because all it said was phone this number. And you wouldn't reach anybody. You had to leave a message. Somebody would. There was no human contact by internet. Anyway, I could rewrite this, I guess, for next time. But it seemed to me that the minutes all became about, it's like the responsiveness.
So, Louise, let me just interrupt for a moment. So we can't really rewrite history. What we could do is we could ask the secretary to go back and check the transcript.
Absolutely.
And whatever the transcript, look at expanding this based on the transcript if that's necessary. But Kathleen,
Can I do it again? I
just check the transcript and see what it says compared to
Because I was
what
just trying to summarize what
exactly
we came to at the end so people know.
I think summarize, it's very easy to get specific actions, get to get programs. I mean, I remember you saying, you said to me directly, are you asking for and reeled off these programs? They are very good, but that's not what I was asking for. And I said, no, maybe I should have. And I think 7 minutes is much easier to get those facts. And I think you'll see, like the STOWO came up, my application. And as I remember, and I could work with you, I could listen to the transcript afterwards. Yeah.
So we'll go with, if it warrants further discussion, that would be another agenda item at another meeting, if it warrants further discussion, but for the purpose of the minutes, Kathy has to be writing or relaying what was actually done and said at the meeting. So the transcript, the written transcript of that will give her more detail. But if that doesn't summarize what it is you were trying to get across, then it could be brought up at another meeting to reemphasize that point. So with that said, could I entertain a motion to accept the minutes with the understanding that there could be a further clarification of the internet access for older adults section at a later date?
Yeah, that'd be great.
Thank you. Thank you. Is there a second?
I'm totally on board.
Okay.
Because I really,
Okay. So all in favor of that motion? I don't want to repeat it because I don't know if I can.
Aye.
you get his motion.
Yeah. She get my motion. Thank you all very much. Public speak. Do you have anybody else on there, Cindy?
Nope.
Great. Highland Valley, Pat's not around. I don't know if anyone else has anything else to update on Highland Valley. I know they might not meet either in the summer for like July and August. So I know Pat's away, but okay. Director's report. Transportation, staffing. Cindy.
Okay. Okay.
I have to look for semicolons.
Okay. So the fiscal report will be, I think at the we're not meeting July and August. So there will be a fiscal report at the September meeting to close fiscal year 24. The preliminary, is that I was just talking with the auditor, reclassify some of the leftover personnel services funds to cover a little bit of mileage and an electrician bill. But there will still be money going back to free cash, as we explained, from personnel services. And then also new and on this expense control report that we get from the auditor is the COA ad hoc building committee got a supplemental appropriation of $9,800, but I think the mayor's office is going to hold the purchase orders. Like, they'll oversee how we spend that money, not just COA. So anyway, you'll get the financial report in when we next meet, which is September. Transportation. So the update is that what we call the MAP vehicle, which is where PVTA is awarded a vehicle for a council on aging that we lease from them, and then we're responsible for it in terms of repairs and maintenance and upkeep, and then training all the drivers properly who drive it, and then reporting out all the statistics to PVTA. But we do all the ride scheduling and we hold the van. So that fiscal year 2022 one has arrived, and I'm just waiting for the lease. And I'm going to apply for a Helping Hand mini grant, not Helping Hand Society, Helping Hand mini grant from MARTAP, which is the regional transit training program, has a $1,000 grant. It's due in July to do the striping and lettering on it so that we don't overly exhaust our van donations account with these kinds of things if possible. So I'll apply for that. The city would do a 10% match on that. So let's say that I do have a quote for it. I haven't looked at it yet. Let's just say it costs $450. We would pay 10% and we'd ask that the grant pay the rest. The policies around transportation have been summarized on a flyer that we hand out to people, and we noticed that it needs to be clearer around what happens when somebody has surgery or rehab and then they have rehabilitation visits. We have said on the policy, if you need frequent medical rides, we may make an appointment for you with an outreach worker to assess what your transportation options are. Some people are eligible for other forms of medical transportation. Like, for example, they can have prescriber-based transportation through Mass Health, but not everybody with Mass Health can get it. Crystal knows more about that. She could explain that if people have questions. Most of the time, somebody who comes to us for transportation is not eligible for that Mass Health transportation. They are either ignorant of or loath to use the Regional Transit Authority, which is perfectly set up for, say you get 6 to 12 visits to PT or OT. That's what that is for. It's to the same place. You know when it is. You can sign up for those appointments in advance very easily. You might have to wait a little while after you have your appointment to get picked up. Sometimes you have to wait a long time, but that is designed for that recurring transportation need. The Council on Aging's transportation program is designed for group transportation to go grocery shopping and go on cultural and social trips. It's also designed for individual errands. If people have a recurring errand, like say a hair appointment, an exercise class, or something like that, what we do is we tell them that every month they have to call us and we see if we can fit them in for a period of time. We no longer allow somebody to have every week, every year, the same exact appointment, because the problem is what happens is when you subtract out all the field trips and the grocery shopping, you only have left a very few hours during our service hours when a doctor's appointment can be scheduled, and everybody schedules their doctor's appointments for those times. So what we'll do is if somebody, say, has weekly hair appointment that they really rely on, we say we reserve the right to have you step back because person A may need to get to Cooley for an oncology appointment to start their chemo. Okay. And could you please make your hair appointment for a different time? So we work with people though. If somebody has memory issues and they'll never remember that we moved their hair appointment, we will take the initiative and call them to help them out. So same thing with grocery shopping. We'll call you if we know you go grocery shopping with us every month, but we no longer keep people on that for 12 months a year to go grocery shopping every month. We make them take responsibility. It's posted in our newsletter. You got to call us. Tell us what you want to do for the month. Do you want to go to Big E, Big Y? So what happens, given what I just told you about, if somebody comes to us and says, I just need 10 visits to PT twice a week? Well, our first step is, have you tried PVTA? They're set up for that. Your recurring appointments will put too much pressure on the COA's transportation system, but we want to help you out. Do you know how to use PVTA? Do you have the senior ID? So that's the role of the outreach worker, not the front desk, to sit down with that person, find out what all their options are, divert them to other forms of transportation. If somebody calls us and they say, I have no options, I need you guys, and I need you twice a week, what are we going to do? If it's like an immediate issue and they got to at least get started, sure, we'll make a couple of appointments for them, but we're not going to give them twice a week appointments for 12 weeks. We just can't. So while they are in good faith making an effort to find other transportation, we'll schedule a few appointments. So you may hear that somebody says, well, I got weekly appointments for my PT. Well, that was just for 3 weeks while we were helping them figure it out. So how can we be proactive about this? We need to rewrite this so it's very clear. And so I went over this with Ashley, the outreach worker, this morning. What I wanted to just make sure this sounds reasonable to you folks. What I'd like to say to people is basically, if you have recurring medical appointments, we will first educate you about PVTA and your other options that might be covered by your health insurance. And we would give you up to 6 weekly rides, and that's it. That's for your whole rehab. If they are saying, but I have 2 a week and it's 12 weeks, we can give you 6 weekly rides. You have to figure the rest out. Rather than flat out saying, no, not at all. Because I think some people need a transition. That might even be too much. Maybe we should do 4 weeks. Well, that's what it is now. So the problem with case by case is that right now, 2 people called at the same time. They both want this. If I fulfill, say, 4 or 6 weeks of weekly visits for both of them, is it fair to one of them to step aside for the one? And chances are they're at 10 on a Thursday, and everybody's at 10 on the Thursday because we've already said, nope, we can't do this. We can't take you to Northampton on Tuesday morning or Friday morning because it's grocery shopping time. The other thing is, if there was a rehab place in Easthampton that most people used, no problem. We could probably do for everybody. We could probably have group PTOT trips. You know what I mean? Because there's so many people who need it. Now, Southampton is easy because people can just take the bus over there and we can help them with that.
But are you considered homebound if you only leave your home for your doctor's appointments and like grocery shopping, and then VNA services can be approved by your PCP to come provide PTOT in your home?
Right.
Yeah. I would say that they should meet with the outreach worker or the Shine counselor or somebody that can get a hold of their doctor, because anybody who can't get themselves to and from the doctor would qualify for VNA services under Medicare Part B.
Actually, are you writing that down?
Trying to.
Could you just say that again? I mean, we have had these conversations, and it doesn't work for everyone, and it depends on their age and all of that.
So
but
basically said it's something to consider, that if someone is homebound, that you might want to
see if they qualify
check with their
for
doctor,
VNA
see if they qualify for VNA services.
They say I
Shine or
cannot
Outreach.
get to my appointments because I do not drive. I own my house to go grocery shopping and I use public transportation for that, then they would qualify for VNA. So technically my voucher.
Most rehabilitation starts out as in-house. Anyway, it's just an extension of those visits that
Right.
we would be requesting
The transportation. Yeah.
of the PCP.
Yeah.
I see Louise has had her hand up.
Okay, Luis,
This was my introduction to COA actually, was when I had a knee. And I needed a PT. I'm not sure. I'd like to pursue with somebody further because I'm not sure. I had recently moved states. A lot of this might not apply. Number two, I was referred to the COA by the visiting nurse. I'm using the long term, but you have a whole bunch of services. So are you pursuing those people and telling them don't refer patients to the COA? Number three, very much, I'd like to, I was going to ask to see a copy of that, but you said you're rewriting it in, this things like phone calls. I mean, I don't, yeah, I just like to see that and maybe make some suggestions so that it will be accessible to more people.
Okay. So what Louise was just referring to is that the VNA, if we change this and make it clearer what we do and don't do, or even if it's on a case-by-case basis, we need to make that clear to the people who refer, so the VNA and the others, because they do refer all the time to us more than we can handle.
my question is, when you say the 6, we would give you up to 6 weekly trips, right? Visits. Is that after they've exhausted, or are they going to automatically get 6 even if they qualify for something else?
So that's a good question. What we do is we require that you have a meeting with the outreach worker and show us that you have tried everything else. And if what happens is the person says, I will not use the Regional Transit Authority, I had a bad experience, or I don't know how, we will say, we will show you, we will say, try again. And the idea would be to provide a certain number of visits as a cushion while they are arranging something else so they can get their rehab started. I'm not sure how many visits we should offer, whether it should be 4, 6, or none. Now, there's nothing to stop somebody from coming to us every week and saying, next week I have a PT appointment. And then we can say, let's see if we can fit you in. That's totally legitimate. What we're talking about is not okay for the other residents of town is to call us and say, I want to grab 12 appointments over the next 2 months, every Tuesday at 1 o'clock.
So,
you know, then we can't handle the acute needs.
so while we're discussing this, why, tell me what's wrong. And again, I'm a bit naive about this. What's wrong with having it, you can only schedule 1 week at a time?
Because the PT needs to know that you've made the commitment to come and do your whole course of rehab, and that and they're scheduling those appointments out sometimes months.
So in medical can be scheduled about 6 months, a year, that's just.
Well, and we do that. I'll schedule today. You have a colonoscopy in November, we'll make that appointment. That is different than hogging a spot on the transportation roster for 12 weeks.
Right.
Traditionally, a doctor can write, orthopedic doctor will write a prescription for physical therapy or what have you, and they often write it for the maximum 3 times per week. They go to the initial visit for their initial evaluation, plus or minus the actual therapy, and that professional will say, you don't need to come 3 times a week.
Right.
Once a week will do for this particular patient, twice a week. Very rarely do people go 3 times a week.
So what I'm not understanding is, what's the difference if we say we're shutting you off at the end of 6. You're on your own to get, even though the last 6 have been scheduled, we scheduled 12, we're only going to cover 6.
Right.
What's the
Right.
difference of saying we're only going to cover 1 and you got to call next week to get number 2, or you got to call next week to get number 3? What's the difference?
Right. We should be transitioning to a point where we don't even do that kind of transportation. And here's a really good reason that Ashley gave me now. PVTA might not agree with this, and I will ask them. If we, as a community, underuse PVTA, either the ADA paratransit van or the senior van, or even the Nashawanic Express or whatever, we are artificially creating a situation where people are depending on the COA to the extent that PVTA can't even show the ridership. I mean, I heard a statement from somebody that only like 60 people use the Nashawanic Express. You know, and so the thing is, we want to help people use the resources that are there, and we want to use the resource the city is providing for Council on Aging transportation for its appropriate uses, which is primarily should be to get around town, to vote and get to the drugstore and get to the grocery store and go on group trips. It really is not designed to be a medical transportation service, but increasingly, because of people's needs, we do that. And we do a lot of work to pair people with those individual volunteer drivers, which in some communities, you know, there's like a $25 charge to use those. But even though they're volunteer, it requires much staff time. So this is like, we need to look at what is, I'm not saying we have to solve this today. I just need to provide an answer to a couple of people this week. And so what we're going to do this week is we're going to have the outreach worker call the 2 people who are on deck who need rehab. We're going to explain to them that we're going to show them how to use PVTA. If you're listening, my beloved residents, you know who you are. We're going to show you how to use PVTA. We're going to get you started with your rehab. But so if any, I don't want to take up the whole meeting with this. If people have ideas, if they want to contribute to this policy development, I welcome that. We're not going to build the policy right here, though, you know.
I'll just piggyback one more thought. When, you know, prioritization is in the eye of the beholder. So is it more important for me to get to my 10th physical therapy session, or is it more important for someone who needs their medication today or needs to go shopping today because they're totally out of food? Where's the priority? And it should be, in my humble opinion, it should be who called first. I need a trip to Walmart because I need to buy some more potato chips. Well, guess what? This PT person might take priority over that. But that's why I think it's call us when you need us, one by one, not schedule out 6 or 12 appointments that, in your words, hogs the system.
Yeah, you could even say subsequent appointments must be scheduled.
Okay.
Like, we'll give you your first 3 and subsequent appointments must be scheduled.
And because how long does it take to get involved with the whole PVK?
Oh my God, you can request an appointment 24 hours in advance. We require at least 48 hours, preferably longer. PVTA is more
And right now it's
responsive.
only $1 each way.
Well, I thought it was free.
Oh yeah.
For
it's
the
free
summer.
For the summer till the end of.
Is paratransit also free for the summer?
I'm not sure.
Yeah, I can check on that, but I see that
But you don't need any special ID cards or.
you do need an ID card, but we provide that service. So,
Oh, so you
so
can appoint
PVTA comes in to the senior center and we have group appointment times. So we have sessions
Mhm.
where individuals come, PVTA is right there and they'll make you a senior ID. We do it multiple times a year.
So as you suggested, why don't you just continue to hammer it out and keep it on the agenda for September? For us to see the final version or
Mhm.
the final.
Yeah, I'm
Yeah, I'm not
happy
seeing too
to
many
help
bleeds.
bring.
I could set up a call too with Crystal and Ashley,
I can
to
even
problem
list
solve
out
around it.
like the SCOs and the PACE programs that provide transportation. Because if they have those insurances, they can just all the case benefit.
And
And
Crystal-
Okay, I would very much like.
Companion drivers.
Because.
well, one at a time. I don't know who you're calling on.
That's very unusual, I know, but there are other people in Easthampton, there are other seniors in Easthampton jumping into those, you know, kind of. And I know that You can, yeah.
I'm hoping, myself included, that companion drivers can fill in during that transition period, and that perhaps we rely more heavily on that, on the volunteer end.
So
Is
let
that
me,
volunteering the same thing?
yes, companion, it's called a companion volunteer driver.
Okay.
And let me report on that next. So, but are we done talking about this for now?
One of them
Mhm.
comment, but it's going to take a minute trying to get back on the track.
You can think on that while we talk about volunteer
Go ahead.
drivers.
Where was I?
So volunteer drivers. So I also wanted to let people know that we inflated our cadre of drivers by, for the first time ever, using senior tax work-off. Those senior tax work-offs will fill their hours soon. We will be back down to the small group of drivers, and at any one time, those are older people who could have surgeries, and they do vacations and so on. So sometimes the public may call us and be out of luck in getting a volunteer ride. That's one issue. So we just put an ad in the next retired senior volunteer program newsletter that we need drivers again because we had stopped recruiting drivers. The second thing about the volunteer rides is I really want the public to understand, yes, it's free. It's a tremendous amount of work to schedule these rides, more than the vans. You have to make a match between the person and the volunteer. You have to educate the volunteer, you know, about the person. A lot of times these are the most frail people. We have to figure out, is the volunteer capable of bringing their oxygen tank, their wheelchair? Right now, we don't have a formal training program for those volunteer drivers, but we try to hook them up with existing training as it's happening in the area. We don't have a volunteer coordinator who can really work with those volunteer drivers in a structured way. It's just me and the front desk, so and the clerk. I'd like to see us develop this program more so that we have yearly training. Maybe we have a yearly meeting with those drivers. They do get supervision from us as needed. And then also they, you know, we respect their time. So if somebody is constantly canceling on them, we might say, you know, you got to step back from this program. Just like if you weren't showing up for your van ride, the same rules apply to those volunteer users. And then we also have an issue where our van rides, you know, we might have a slow Wednesday because all those people sort of wanted the volunteer ride, but we can't predict when that's going to happen. And so once in a while we notice, wait a minute, we're light on van rides. Oh, all these people are taking the companion rides, you know, because so we try to do a balance. And so we try to prioritize the senior tax work-off van drivers if we know they need more hours. All of these factors just require so much time and thought to make all these balances happen. So yes, we have this companion program. Yes, it's going well. It takes people out of town. I mean, out of our region. Our region is Holyoke, the Northampton and Villages, and Easthampton and Southampton, and the very line of Hatfield. So companions can go to Amherst, Hadley, Westfield, Springfield, West Springfield, Chicopee, wherever. And they can also do after our van hours. So the last appointment on the van is 1:30 in town, 2 o'clock out of town. You don't have to write all this down, Kathy, because we got a sheet. You can just refer to the policy. So it does do an incredible amount of work, transportation work for us, but also it's hard to rely on. And when we said we would put this program back in, we said pending how it went, because Brendan, the former director, had ended it during the pandemic and was loath to bring it back because of how much work it was, because there was no volunteer coordinator. But we have a clerk now and we can track people's hours and it is going better. So I'm not saying we should eliminate it at all. We do need more drivers, but just so you all know, there's a lot of work that goes on that might not be represented by the numbers.
Go ahead. Based on putting that together, what we were talking about before, about the PT visits and all of that. Is there any opportunity for you to bounce that off with your colleagues in other senior centers and see what their policy is and how they're handling it?
Yep.
So maybe you don't have to reinvent the wheel.
Yes, that's a good idea. Very few places do the level of transportation that we do. We're almost like in Hampshire County, the leaders probably in how much transportation we're doing for medical appointments with paid city staff, I would say. Bob, what do you think?
Yeah, definitely.
Now, what about the VA? They have volunteer drivers. I wonder, they must have a program. I don't know.
Yeah. For veterans, there are transportation services. And so generally we're not needed to transport veterans.
I just didn't know if they had a training program that you might be able to look at.
Thank you, Kathy. That's a good idea. And then also the training program that trains our paid drivers. I found out that the passenger assistance portion, our volunteers could take that, defensive driving and, certain other classes. Yeah.
A question on the liability with the volunteer driver. Is that assumed by their own personal insurance?
Yes. So they have to show that they have insurance on their vehicle. If there is an accident, the city will pay out up to $10,000 from the city's insurance policy to cover the gap between what the individual's insurance will cover and what and then there might be a little tiny bit in very limited circumstances that if you're an RSVP volunteer, that the RSVP insurance will cover, but it's very limited. So yeah, it is a risk.
There's another program that's called BINS, and it's only like $100 annually, and it covers volunteers in any capacity.
No.
So I used to have it when I was sadly. So I'll send you the link for it.
Thank you. Vince. Okay.
First, if you've talked to Easthampton neighbors, especially Jackie, and their coordination benefits, they did the same thing. And second, it's very likely that there is I can't remember now, but there's database of CMSs that would do most of this work. I mean, I was involved in a similar thing professionally years ago. It's probably moved on, but a lot of the coordination doesn't have to be would be done with somebody, a human being overseeing it, but not having to spend loose.
So what Louise is referring to is that there is software that would allow the volunteer drivers, the residents who use the service, and the COA to communicate using software so that then Marie could pick up a ride without us having to referee that. It's expensive. We have talked with different programs in different areas like the Quabog connector and the Tri-County, et cetera, et cetera. And so we know like there's different brands, Trip Shot and other brands that we will be looking into, but what we've been doing in the meantime is waiting for my senior center, which is the database we use for the Council on Aging, has said that they're improving their transportation module. They're finally done. And there's a new paid level above what we pay for, and we want to see what it does. As far as I know, it does not do any of that. All it does is tie more easily into so you don't have to open like MapQuest or Google Maps on the side to count how many miles it was. It doesn't allow for this interactive way that people can request rides, schedule rides, and pick up rides. And so we do know that that is more efficient. We just don't know if we should get it on top of what we already have and if we can afford it. And also because of the number of rides that we do, it might not be worth it. We're talking like places that do thousands and thousands of volunteer rides a year. It's worth it for them to spend like $10,000 to $15,000 a year or whatever for that software program. So, but we will look into it more. But I know we have other things on our agenda, and I just wanted to give you a time check, which is that it's 12:44.
Okay, let's jump into old business. Board statewide guide.
So Crystal was going to look at what are some options because we said we were going to meet in the summer to digest this guide outside of open meeting.
Yeah, I wanted to know, whether you want to meet in July or August, depending on what your schedules are, and if you want to meet, off campus, not here, but like at somewhere where we could like rent and have it kind of be like a lunch and learn, where we can learn more about things like conflict of interest and fundraising and I don't know if there currently is a job description, but I feel like having some sort of like signed MOU or job description at least gives a level of accountability, especially when people are not representing the Council on Aging in the manner in which is outlined in that manual, because it very much says that we are to be always supportive of the COA, its mission statement, and the executive director. And I just know from chirping around the town that there are representatives that are on this board who publicly are not supportive of the senior center. And I believe that nobody would do that out of malice. They do it out of not being educated and not knowing that that is a requirement of being a board member, is to not speak negatively about the organization that you are on the board supporting. And if you do have constructive feedback, you speak directly to the executive director, because you are representative of the Council on Aging board. So when I heard that that was happening, my goal was, well, let's educate the person, people, whatever, that don't know this, that are doing this, because I want to make sure that they understand the role of being on the Council on Aging. And when you brought that up at the last meeting, I thought, if we've never had some sort of formal training or orientation for board members, having it in July or August would be a great time, making it informal, because education is how we're all going to be better at what we're doing.
Yeah, I definitely saw that document as sort of a roadmap guideline for what a board member is expected to be and that board member is expected to contribute. I didn't, it might be buried in there, Crystal, because I didn't read it verbatim every, this 45 pages.
Yeah.
But I didn't see where it specifically said you might look at this expertise, whether it's fundraising or this or that. I saw it more as the duties and responsibilities and expectations of a board member in their role in serving on the board. I can tell you from experience in working at the bank for 45 years, we could knock heads like crazy in a board meeting. But when you get on the street, the bank was the best thing since sliced bread.
Right.
It didn't matter how upset customers were or how upset I might be with a policy.
Mhm.
I don't agree with that policy. The majority ruled and said, sorry, this is going to be the policy. When I got out on the street, I supported that policy because it was a collaboration of the group. Just because I didn't support it, I didn't get, yeah, those idiots back there, and those idiots on the board, they're doing this and they shouldn't be doing that. You can't do that kind of stuff. It's got to be supportive, even though you might be knocking heads in a board meeting. It's got to be support. Now, the difference is we're in a public board meeting, so the public gets a chance to see us knock heads, but so be it. When you get out on the street, you're supportive of the whole, if you will.
Yeah, I always respond, that we're a continuous work in progress. Like if people have like feedback that's constructive, I say, thank you so much for letting us know. We can't fix it if we don't know about it. We're a continuous work in progress. Like, thank you for bringing that to our attention. I'd love to like more information. And that's what I think that any of us as board members, if there's anything that we think the senior center should be doing that it's not, or doing better that it is doing, then it's our job to help it become better. That's what the...
Please.
Yeah, thank you. I only skimmed it 45 days or something, but there's very little that I find about diversity, about different people, about widening services. And that's what people come to me. And the things that I passed on, mostly I've started to get feedback. And I feel like, I shouldn't say this in public, but I feel embarrassed that I, send these people who are seniors to the senior center to start with, because if something is okay, I can tell you later, but I'm just wondering if there's anything like that we could have.
Oh,
Yeah, more.
I was just going to jump in and say that we can't be all things to all people based on the limited budget we have. So my quick answer to a person like that would be, we're offering all the services we can offer based on the staff we have and the budget we have. So if someone says, well, I'd like to see this happen at the senior center.
Sorry, it's not that, it's attitude. It's attitude.
Then that's different, and that's something we could, maybe the training helps us with that.
Yeah, I think there should be training. I couldn't find it quickly, maybe I was.
Right.
But are you saying training for the board members or training for the staff? Because I think what Louise is saying is that the staff have an attitude that does a disservice to the people of Easthampton. So she's embarrassed to refer seniors to the staff.
Oh,
That's what she's saying. She's not saying that the board needs training. That she's not contesting that. Please correct me if I'm wrong, Louise. You're not contesting that the board needs training, but you are saying, as part of looking at what board members do, that you think the staff need training to improve their attitude, right?
Both.
But
Because what's being raised now, and I know I'm doing most of the talking, but I'm the only person, I believe, who's got experience here as a user, not a super fan.
Well, 1, 2, 3, 4, 5 of the 3, 6, 7 board members are senior center users sitting around the table.
But are they also professionals?
and also
Professionals?
In services, cool. Anyway, okay, I'll ask you an example. I had somebody who phoned about asking about help with a computer, a simple computer program, because she knows computers, but this is she's become low vision, and what she found was we don't do that. Now that could be, I mean, yeah,
It doesn't sound familiar, because we get a bunch of people like that, and we work very closely with Kathy Carey here, who's like our diva of low vision.
But I have spoken to several people regarding the computers, and I've hooked them up with various organizations, and I don't know what to say, you know.
see,
Unless it was a volunteer on the phone and they would know a new volunteer or something. Put into the phone.
Yes, I mean, I haven't asked her yet. She obviously cannot see it now, but she has been able to until very recently. A doctor or somebody professional said, use this. And it just seemed.
So then
The senior center offers weekly computer
She doesn't see it.
sessions, and also the library offers.
The libraries, actually, they would be more responsive.
But just since you've brought this up, and I know Tom wants to rein the conversation back to the agenda, but just for the public to know, if you call us and you have a low vision issue of any kind, we don't have as much expertise as Kathy Carey does, who runs the low vision group. So we partner with Kathy and the low vision group to evaluate that person's resources. Do they have a computer or not? What kind? What do they need? And
I try
together,
to get them to the correct person. You know, a lot of times, as anywhere, you know, you can call and then they call you back and you don't answer the phone. I know that happens a lot.
I just want to, and I really don't need to rein this in too much. I mean, I don't have to be here till 5 o'clock. Just kidding. Louise hit a catch word to me, which was attitude. And in my experience, again, if there's an attitude issue with the way someone responded, with all due respect, I don't see that rising to a board level. It's typically internal management. And the board might get involved when someone says, you know, I took it all the way to the top and the top didn't respond. Now I want to go to the board. When it comes to attitude, yes, when it comes to attitude. So I call and this person is rude to me every time I call. That's an attitude issue. Or this person blew me off, or this person told me, nope, we don't do that. Bye. Okay. Now if I got that kind of response, like registry of motor vehicles, that's a bad example because you
It's a
can't.
good
Vote. So if I got that kind of response, Louise, my next call might be to the director. And I would expect the director, okay, I talked to Susie Q and this is the way Susie treated me. Director would go talk to Susie Q and have a one-on-one and try to work that out. If it didn't get corrected, or the director, now I might want to talk to the board. But I don't see day-to-day management issues rising to a board level unless they don't get resolved by the director.
It's diversity, very simply, and.
What do you mean by diversity?
There's
so many kinds of diversity.
There are.
You're saying there's a lack of diversity, or lack of understanding for people who are diverse?
I've been told I'm diverse and thankful by an employee, a board member. An employee of COA who I don't want to, but it was meant very well. I mean, you don't go around saying it. And I don't know where this starts. I do know that I'm doing too much talking here, and I'm doing that because I seem to manage to be diverse. And the center doesn't, if you want to talk about racial and all, the center doesn't even, most people wouldn't consider it. I mean, you haven't broken that down. So
I think if there's like specific, if you as a board member are referring somebody to utilize services at the senior center and then you get feedback that they felt the person that they contacted was unhelpful, then that would, to me, initiate an email to the director and say, you know, I recently made a referral to somebody in the community. When they called with this question, they felt that the senior center would help. Because then Cindy can say, oh yes, we can handle that, and then educate the person who wasn't helpful that answered the phone, and your referral gets a good outcome. So it's like fixing the problem rather than just allowing it to exist.
Right.
And so the reason I want to rein this in is because we went into a whole different topic.
Right.
I want to come back to the topic of board training, which I think is always important, always necessary. My only question that somebody might have to dig into is, we meet as a group. Can we meet outside of a formal public meeting and
For training purposes, you can, because you're not being a deliberative body and making any, you can't talk about council on aging business at all. You can't talk about the specific council on aging.
set it up?
Okay.
And make sure it's
Set it up.
So what I can do is just like send out like some dates and then whatever works for everybody. Do you want it like during the day or
I think
afterwards?
this time is,
Yeah, I
Like
think there-
lunchtime or afterward?
I think lunchtime, I mean, there's only a couple of people on the board that are working
Yeah.
for a living, you and Pat. So, if you can make it at lunchtime.
Yep.
Because I can do alcohol at lunchtime too.
Makes it easier.
To bring your own maybe.
so thankful. I'm still restricted mask wise and will be forever, it seems, and it's not even for my own health, so I've been choice. So I would say outside, if there's a comfortable place, not eating, because nowadays is everybody's eating apparently. Cardiologists, anyway.
We can always get a pavilion at the park, for city business.
we have to consider staying remote.
Yeah.
Yeah.
to
Yeah.
access.
Well, that at the minute we're outside, we have 0 hybrid. Okay, but that can be worked out outside of this
Yeah.
meeting, and I just want to give you guys a time check. It is 12:58.
Okay, we want to, so Crystal, you'll send out some dates, see what we can do.
Yeah.
And, yeah, work out the details. I mean, maybe it's something that could be videotaped for those like Stan or others that don't have access. But we'll figure it out. Ad hoc building committee. Is there any updates?
So we were going to ask Leslie to give a quick update as the secretary of that board or committee.
Move right up.
So, you can see, and I'm not giant talking in the back.
Yeah.
So,
Do you want to introduce yourself, Leslie?
yeah, so I'm Leslie Button, and I am a member of the Easthampton Council on Aging Ad Hoc Building Committee. I've been on that group since its inception. So the committee has been meeting regularly since the beginning of the year. And we're doing our work as, you know, basically as 4 working groups, working on various activities, you know, site review, center visits, site selection, programming, and survey of constituents. So we've made great progress. We will be meeting throughout the summer. I'm on the site center visit committee, and that's been pretty eye-opening, to be honest. Because I am a regular user of the center, I see what's in there and what's not in there. And to go to other places and go, gee, why can't we have something nice and new, that would really meet the needs of current and future, users of the center? Because the facilities we have, I'm expressing my opinion, are inadequate in every way, I think. So I'd say just stay tuned. There's a lot of work going on. I know that the group that's working on connecting with constituents and stakeholders is working pretty diligently. They will be sending out a survey in the fall, and holding sessions with residents of the community to hear from them what it is that they would like and need.
Can I add to that? So there was a supplemental appropriation that was approved by City Council for $9,800 to help with these stakeholder focus group sessions and the survey. And I am going to speak with UMass about helping us. What would it cost, and do they have time to help us make sure before we send that survey out that everything is worded as it should be, so that on the receiving end we get good data? And could they maybe help us analyze the data if we want to make complex comparisons and not just a simple 10 people answered this, 50 people answered this? And so, because we know that we're distributing it by email to our list of over 1,100 people, and we're also going to do a robocall inviting people to come in person and do it, or to do it over the phone, so that we can hit every method of getting that survey out to as many people as we can. We still might need to mail it to some people, in which case that's very expensive. So we want to save most of the money for consultation. And then for when we have stakeholder sessions for food for that, like a pizza or something evening. So we will be, I hope to have all of that worked out so that the survey can get distributed in September. So the next time this group meets, who knows, you might be taking that survey.
Already took it.
Yeah, she's on the survey development committee.
If I can jump in for 30 seconds, as Pat, as I think you might have had in recording because of this on the site. We had said from the beginning, one of the biggest hurdles we would have is finding a site, an appropriate site, whether there's an existing building, whether it's vacant land, whatever it is. And the city assessor has been very helpful. We've determined that we need approximately 4 acres to have the building size we need and the parking we need. And the city assessor was able to provide us a list of every parcel in the city, whether there's a building on it or not, whether it's city owned or privately owned, of 4 acres or more. Believe it or not, it wasn't that big of a list, but we have it in our possession now, and the committee's going to sift through it. Keep in mind, there's a lot of locations that you would just say, forget this, forget that. It's way off the beaten path somewhere. It's landlocked in the middle of nowhere. You can't even get a road to it. But there are sites that obviously are pretty attractive, and we'll continue to pursue those. Okay, new business, membership. I believe Leslie has expressed interest. And have you submitted a letter to the mayor?
I did.
Great. Leslie's going to be a new member as soon as she gets knighted by the city council. And I believe if that's on the agenda for this month, I believe it'll happen in July. I believe.
Before, there might have been some confusion about which committee it was for and whether there needed to be a city council appointment. So I don't know when it'll be on the agenda. I tried to clear it up.
Yeah.
So.
Because I'm working on one on another committee I'm on, and I ran into the same issue with sporadic meetings, and they're not going to get approved till August, unfortunately. But it will come. Absolutely believe me, it will come.
We're not
So can
meeting
she
in
not
July.
quickly attend a training?
Correct.
this summer?
She can attend.
Sure. Yeah.
Because I think that'd be really important.
In fact, the friends are in the same like part of the website, the statewide website, in terms of like a board member's friends and getting education. And it could be that some of this training material might even be good for Friends board members. I don't know, because they're trying to develop support for Friends board members as well.
Yeah,
Anyway.
when I was talking about fundraising and conflict of interest, that's what it gets into how we can't do fundraising.
Okay.
In that document, and it gets into how, like say we were doing a fundraiser for the new senior center, like we can't directly solicit funds for that because we are representatives of the municipality. So there might be many people on the board that don't know that, and that was when I first started working at the Northampton Senior Center. I didn't know that we couldn't do direct, fundraising. So it's just kind of just like information that I think is valuable.
Okay.
Would you do business or what?
Are you going to cut us off there and
Yes.
put the other thing? Can you just list out the agenda items that are getting moved to next time for the minutes? Please.
The transportation,
Follow up, right?
transportation staff, was it staffing? No.
Oh, there was a staffing update that I didn't go into because we're not ready.
So that would be contingent.
But also there's another item on there about membership.
Yeah.
It's about the chairperson.
Right,
It's that would have to be September.
September. We'll do that in September.
Because did you set a deadline for how long you're willing to be?
No.
Okay,
I did not.
Okay.
I'll talk to you about that.
okay.
So the only item I think we're moving forward is I told you stuff. In other words, you're going to bring back a draft of that document to us.
I'm going to tell you what we decided to do
Perfect.
because it's operations. It's not,
Not board deliberation.
Right.
So is it transportation staffing follow-up that we're doing?
no, it's
The operation.
you will see a copy of the new policy in September
Okay.
with an opportunity to give input, but it
Okay.
will already be in effect.
Yep.
That doesn't mean we can't change it.
Okay.
And that when we have a staffing update, I will provide a staffing update, but we didn't have one today.
And Crystal will get to us with training dates.
Training.
But I entertain a motion to adjourn.
So moved.
Second.
A second. Because if we don't have a move in a second, we have to stay here to do that. Kathy.
Yeah.
All in favor?
Aye.
I stand. Thank you all very much. See you in September.
This government meeting is brought to you by Eastworks and our local cable subscribers.